so we are going to be doing a little hip evaluation. So I'm not going to do necessarily muscle tests, I'll do a couple, but basically what I'm looking for is the range of motion. And now this hip for him is kind of not necessarily a problem hip, but it lacks a little bit of motion. So coming this way, he is very tight. And this way is really bad. Can you feel that? Mm-hmm. Yeah, so he's super restricted on this internal range of motion. So that's kind of what we want to help to free up. So a lot of times when you are restricted in your hip motion, it affects your low back. So when you're trying to work out any low back issues, a lot of times you have to unlock the hips and the pelvis. Yeah, so for him, we really want to clear up this internal hip rotation. And now this is a way to help free up the hips. So we're going to come all the way out this way. Let it relax. Any pain with that? Okay, just tight. What I usually do is try to anchor it down with my own hip. I try to use my body as much as I can so that it's easier on my body. And then we're going to lock down this opposite hip here just so he can't cheat the motion. And really this can be a test and help to free up the hip as well. And he's pretty tight through here too. So I try to find the end range and then continue to work past that just a little bit just to open up the hip. So today at work he was sitting quite a bit because I just asked why his hips are so tight. Because we did this the other day too on him before we did a workout, and it wasn't this tight. You can just tell his muscles are fighting it a little bit. He's shaking. And then I go through again and apply a little pressure just to see joint play, I guess you could call it, just to see where he's sticky at and just help glide it through that range of motion. And already just by doing that little bit, he's improving just a little bit. And now this is just to help stretch out the glute, the piriformis a little bit. And again, I'm just anchoring his ankle down with the front of my hip. And then helping him get past that end range just a little bit. How's it feel? Tight? And this is a big reason why so many people that sit at their desks all day on the computer have low back pain, is because they're in that sitting position and their hips get super tight, and usually their glutes get turned off due to some sort of inactivity, and the low back takes on the role of what the glutes and the hips are supposed to do, and it beats up the low back a little bit. And then we're gonna recheck him again. Come up to this position. Good. Do a little bit of the hypervolt. Let it hang off this side here. And then now we're going to do just a few distraction techniques and adjustments to the hips. So the first one's just a simple distraction. just to kind of help pull the head of the femur out of the socket a little bit. Give it a little breathing room. Okay, and then we're gonna do pretty much the same exact thing we did to this left side. On the right side, not so extensive, just because the movement on his right side is actually very good in comparison to this left side. So we'll do a little bit on this right side, and that will be it. That way's a little restricted, and this way is a lot better than the other side. Alright, now we're gonna just do the same thing, adjust this ankle on this right side and this right knee and hip. Hang on this side. Okay, so that is going to be the end of the video. Basically, with hip stuff, it's just finding where they're restricted at. A lot of times, too, I find that when you free up the hip stuff, it's easier to adjust everything above, like in the thoracic spine. So yeah, that's going to be the end of the video. Hope you guys enjoyed it. If you have any questions, put them down below. Subscribe to the channel if you are not already. And I'll see you guys in the next one.
What are you doing?